Hello, my name is Carol Johnson. I'm an occupational therapist and a certified lymphedema therapist. I'm working with JoViPaK as their technical advisor and also as a product designer. We've prepared this information video to assist our customers when alterations are necessary for the JoViPaK products. Some of the more common reasons for when alterations are necessary are for those patients whose edema loads fluctuate from time to time, making it more cost-effective to alter the garment rather than replace it. Over time, if a JoViPaK garment has been well worn, it will require a repair to extend the life of that garment. Sometimes after the original order, an alteration may be required for optimal fit. In preparation for JoViPaK to alter the garment, it's important to follow these guidelines. All garments must be cleaned prior to returning it for alterations. This is an FDA regulation as we cannot run soiled garments through our machines. Follow all the cleaning instructions that come with the garment. If a garment is returned to our facility that's not clean, there will be a laundering fee added to the alteration fee. Be sure your patients have done their part at home so we can quickly and effectively make the changes in the garment here at JoViPaK. Garments should fit snugly and conform to the extremity without binding in any one place. Remember, these are bandage liners and not compression garments, as the patient will gain the additional compression from the Jovi jacket or from an external wrapping system. Less compression is needed at night, so don't worry if one hand can be placed into the top of the garment or if it doesn't feel like it's giving the same compression as a daytime flat knit garment. These liners are designed with built-in gradient to be tighter toward the distal end of the limb and looser toward the top or proximal end to help move fluid toward the central circulatory system. To eliminate donning issues, simply make sure the garment is comfortable to the patient, fits smoothly on the limb, and the material is resting nicely against the skin. Providing new measurements helps us to see the patient's increase or reduction and allows us to have this documented in their file. But it doesn't necessarily mean that we know how much the garment needs to be altered based on these numbers. However, if you're sending the garment back under the Guarantee to Fit policy, new measurements are required. Therefore, we want you to know how to mark the materials. Also, a picture is worth 1,000 words. So if you feel there's something we need to see about the way the garment fits the patient, don't hesitate to email us the photos at info@jovipak.com. Assemble your marking tools. Optimally, you should use a permanent marker or an ink pen for marking on the garment or on the materials. Your alteration forms are important, and also, of course, a tape measure. First, have the patient don the garment. If the garments are too small and the patient cannot don the garment as it should fit, call us immediately. Sometimes the first few times of donning the garment, there's a sensation of being very tight, but as the foam packs out, the donning process is easier. Be sure to use donning aids when possible to assist, as these can make the difference between getting the garment on and not. Basically, there are two options for alterations of a garment that's too small. We can add a zipper in the fabric, or we can add a gusset in a seam to allow the distal limb or body part to slide into place. Zippers have a tendency to buckle in some fabrics, so be sure to consult with us before you set your heart on a zipper. Mark the fabric of the garment where you believe the zipper or gusset should be placed. You can also measure the area that's too tight and record it on the alterations form. We'll decide the appropriate alteration method that's needed. Make sure the garment is positioned on the body as it should fit from the hand to the axilla or the foot to the groin. Fingers should be in the open-fingered glove, the thumb in the thumb stub, and the foot, of course, should be at the heel. For garments that are too big, locate the seam on the garment and equally pinch both sides of the seam to make the garment conform to the patient's size. You may try to use binder clips to help hold the garment while you're addressing all areas of the garment. I will demonstrate. Now, how does that feel?
Better.
If I take a little bit more out, is that even a little bit better? Or is it too tight?
It's better.
I'm going to use a chalk to make my initial marks on the front and on the back. You can see that my binder clips may not be exactly where it ends, so I'm using my thumb to pinch. Get as much feedback from your patient as you can. I'm using the chalk to begin with, and then I'll go back and mark it with a more permanent marker. Sometimes we lose the chalk marks during shipping. And how about here? This is okay?
That's okay.
Okay. It is not advisable to try to pinch anything in the main body of the garment. We cannot alter garments in the middle of the fabric. Seams are the only place to make this alteration. For example, in this garment, we're going to insert a gusset from the thumb area all the way to the end. The patient had increased in size, so in order to prevent us from having to replace the entire garment, we can alter it by putting a gusset. Here then is the finished gusset alteration. As you can see, the seams are on the outside. The added foam-filled fabric accommodates the patient's enlargement as requested by the therapist or the fitter, and without a need to replace the garment. For this demonstration, we're using a garment that is much too large in circumference in order to show you the progression of a misfitting sleeve from before to after alteration. The principles we use here are easily adapted to other garments. We can add a zipper in the main body of the fabric or add a gusset in the seam to allow the distal limb or body part to slide into place. For example, this patient has experienced some enlargement, and so this garment needs to have a gusset installed from the base of the thumb here all the way to the top. I'll show you the results shortly. Zippers have a tendency to buckle in some fabrics, so be sure to consult us before you set your heart on a zipper. Zippers are never placed across a joint, so consider placement with this guideline and mark on the fabric of the garment where you believe the zipper should be. For example, like this. You can also mark the area of a garment that's too tight and note it on the alterations form. It's also helpful if we understand if we're going to put a gusset in, from where to where you can mark it right on the fabric. Jackets needing to be altered must be marked the same way as the liners if sent by themselves. For jackets sent with a foam liner, we will alter the jacket according to how much was taken off of the liner. If you'd like a new Jovi jacket to go over the newly altered sleeve, please provide us with new custom measurements so that we may be able to construct a new pattern for the patient and keep it on file. Remember, the life of a Jovi jacket is approximately 6 months and will start to show regular wear and tear after a few months of use. No different than most articles of clothing when worn every day for 8+ hours. Jackets can be altered to increase the amount of compression they provide, but over time the elasticity will wear out, similar to your daytime compression garments, so a new one is recommended. To avoid having to reorder mid-year, you may consider ordering 2 jackets with the initial JoViPaK order. If you feel the length needs to be altered in the center of the garment, for instance, if the distance from the heel to the knee is too long or too short, but the length from the knee to the groin is correct, a remake of that garment is going to be required. Contact us as soon as possible, and we'll direct you as to how we'll resolve that problem. We're going to use a leg garment to demonstrate the marking techniques to reduce the length of a garment that's too long. Have your patient don the garment and find the level of comfort in the natural resting position once it's on. If the garment is too long and it's into the crotch or into the axilla, reduction is going to be necessary for a good fit and for your patient to be compliant in wearing the garment. Find the desired landmark on the patient's body that will provide the best length. And in this case, I'm going to find the gluteal fold, which is right here. I'm going to approximate the garment at that level. I'm going to mark the garment on the outside with my marking tool, and in this case I'm using chalk. And I'm going to get that line exactly where I want it and the length. And in the groin, a little hint is if you use 2 finger widths from the highest part of the groin, or the G measurement, mark right below that, and that will be a very comfortable fitting garment for the patient. Then you can go back with a more permanent marker to mark this garment.